Welcome, I'm Dr. Andrew Cohen, and welcome to the Healthiest Kid on the Block, our podcast. And today we want to talk about a particular part of the body, specifically the nervous system, that has huge effects on your health and well-being, and especially the health and well-being of children. And today I was looking at Facebook and I saw some posts about this, and it's popped up from time to time. It's not new news. And in fact, in chiropractic circles, it's well over 100 years old. But it seems like science and medicine is finally catching up to this idea, but their way of dealing with it is sort of, let's say, mechanical or electrical and a little bit dangerous. But what we're talking about today is the biggest nerve, or the most important nerve, I should say, in your body, and that is your vagus nerve. And let's talk about how this impacts kids. Now, the vagus nerve is a nerve that passes right under your skull, behind your ear, right behind your jaw. It's a really large nerve, and it's the main nerve of what's known as the parasympathetic part of your nervous system. It is a nerve that in Latin is called a wanderer because from this part right at the base of your brain, it passes right past the first bone in your neck, but it wanders down to all the organs, or most of the organs of your body, your liver, your spleen, your heart, your lungs, and very important, your digestive organs. And what the vagus nerve does is in times of peace, or most times, it keeps you functioning calmly and peacefully. So in other words, when the vagus nerve is disturbed, if the tone, this is what they call it, the tone of the vagus nerve is not correct, if it's too low, then these organs will not function properly. And then you ultimately have a bunch of symptoms, and you can get a lot of weird or complex symptoms, and there's really nothing wrong with the organ itself. The problem is that the supply to that organ, the most important supply coming from the vagus nerve, is being altered. So in other words, if you were trying to communicate with somebody and there was static on the line on your cell phone, you'd have broken communication. So you need this clear communication from the vagus nerve if your organs are going to function properly. Now, you take a child at birth, and we've talked about this in previous podcasts, but let's get clear that the number one area that gets affected from birth trauma, or the pulling, or the forceps, or the vacuum extraction, or the intrauterine constraint, or various things that happen at birth, the number one problem is that the upper bones of the neck get altered and pulled and yanked on, and they create an environment around that vagus nerve that decreases the tone of that nerve. Now, the vagus nerve is part of the parasympathetic. So now you got all these organs in the child's body already not getting what they need. But the other part of the nervous system, the sympathetic part of the nervous system, the fight or flight, now takes over in prominence. So what happens is that you have maybe an increased heart rate, or a leaky gut, or a gut that's not absorbing all the food, or it's not moving properly, so the kid is constipated. And then there's irritability that gets created from an altered vagus nerve, so now the child can't sleep. So you could see that there are many different things that can happen when the vagus nerve tone is altered when the neck is damaged. And the neck is damaged quite often at birth, even what appears to be like a really good natural birth. Sometimes there's trauma there, and you don't notice it until a few months later when they have all these colic and reflux and ear infections and all these problems, and people just accept it as common. But it's not common. I mean, it is common, I should say, but it's not normal. These kids that are under chiropractic care, I mean, these things usually rarely ever occur, or if they do occur, they clear out very quickly. So there's a big difference when the vagus nerve is functioning properly than when it's not functioning properly. So the other thing that's going on in the news, and people are starting to catch on to, is this idea of inflammation in the body, how detrimental it can be. And what many people don't realize is that the vagus nerve is actually a moderator of inflammation. It keeps inflammation down in the body. It's one of its natural functions of the vagus nerve. So once again, you have trauma, the neck is irritated, now the vagus nerve is irritated, and you have inflammation going on in the body. Inflammation in the lungs, We call it congestion. We call it asthma. Inflammation in the middle ear. Now you have fluid in the ear. You have an ear infection. Inflammation in the back of the throat. You're going to say it's sinusitis. Bronchitis. You're going to give it all kind of names. But you could treat those symptoms. You can give antibiotics, and you can do all kind of lotions and potions and do all these fancy things. But the vagus nerve tone needs to be corrected. And that is exactly what we do in chiropractic. It is the first thing I talk about with my clients, kids and adults, and it's the first thing we go to correct. Number one, every time. Every time, if the upper neck is not addressed, if the vagus nerve is not corrected, then everything else you do is really going to be secondary or tertiary. It's going to have a very limited effect. I don't care if you're eating the perfect organic, locally grown, beautiful food and exercising on a regular basis. If your vagus nerve is understimulated and it's not properly functioning, you will have health problems. So this is what we do in chiropractic is we correct that vagus nerve, and then we make sure that all the other nerves of the body are corrected. But the vagus nerve does take prominence, and with kids, this is when we see the miracles, so-called miracles. They're not miracles. They're just the body functioning correctly again. The kid with the ear infections who doesn't get them anymore. The kid who throws away his inhaler. We're not treating infectious disease. We're not messing with the lungs. We're not looking inside kids' ears or anything like that. It's just a matter of getting their body functioning again. And when you correct that vagus nerve, that's exactly what happens. And this is when great stuff happens. So this is a quick podcast today, but it's very, very, very important to realize that the majority of children that I check have some irritation of the vagus nerve. It's the majority. And some of it is mild, but for a lot of these kids, it's pretty significant. And it takes maybe a few weeks for most of these kids to clear it out and have a huge impact on their health and wellness. And the thing is that if it's not corrected as a child, it only gets worse as you get older. So you have chronic inflammation, chronic ear infections, chronic sickness, and you carry this off into adulthood, and you become a lifetime customer of the pharmaceutical companies, taking medications and drugs. And a lot of times, you hear people say, well, I don't like to take these things, or, they feel like they have to. What I'm saying is that if you correct this, then you won't have to. It's not a have to, it's a choice. And in this case, I think a better choice is to make sure that the upper neck is clear, especially with kids, especially with newborns, and the vagus nerve is functioning properly, and you'll just be a much, much, much healthier person. So that's our podcast today, The Healthiest Kid on the Block. You can look in the news, you'll see articles about this, you'll see that they're implanting electrical stimulation of the vagus. They're trying to increase the tone. They're trying to wake it up. But the surgery to put in this sort of implant, first of all, it's surgery. And then putting in the implant, it sometimes can be dangerous. There are obviously complications from any surgery. And we can correct this with a very light touch. Very simple adjustments to these kids. So this is, I think, an unnecessary thing. I think medicine and science is coming around to understanding of the nervous system. But they just don't have the tools, the simple tools and the more effective non-invasive tools to work on this stuff. And in chiropractic and pediatric chiropractic we do, and this is what we do every day. So until next time, make it a great day, and thank you for listening to The Healthiest Kid on the Block.